Okay.
This is the most pain-free I felt in months. Okay,
Great.
so I feel the tingle coming back just now as if I had to break the spell.
All right, this is before the test.
Okay.
And so just kind of tell me what's been going on and things with the arm and the panic and the anxiety, etc.
After the accident,
That was 2009?
2009, 10/13. After that, I just continued. But it started with pain in my shoulders. But at our work, everybody has that. So we'll take a minute, give each other a little massage. You know,
and you have work
it's
at work
night.
yeah.
So it's doubly stressful. I have to work from 6:30 p.m. to 7 a.m.
Wow.
Right.
And that's computer stuff you're saying?
I'm doing computer. I'm doing on-the-floor nursing, cardiac nurse.
On the floor?
I'm a floor
cardiac
nurse.
But you aren't down on the floor.
If I've got to be, I'm on.
Oh, yeah.
Whatever.
Right.
I do whatever needs to be done. So basically, after the accident, I just kept going.
No, that you said the accident. You were driving and there was some patch of water or something.
Right. I hydroplaned, slid, did that, and then over, and then I was
over a cliff.
Over a cliff, down to a vineyard, in the rain. My head went sideways, and I think that's where the whole neck thing. So, long story short, Nancy, coworker, this was before any neck pain for me. It was just shoulder, but tense. You know, we're lifting, moving. She says, "Oh, I feel like I've got crunchies in my neck." So, as the week goes on, I finally bring her a rice bag to put in the heat, at the cold, whatever.
She was in the car with you?
No, she's coworker, friend. And then her crunchies go away, and I've got it. She says, "Thanks, Katie, sorry." But then it started. The crunchies left, but the neck started really hurting. That's when I went to Dr. Had the MRI previously, so yes, you've got this, 1, 2, 5, 6, 7, compression, nerve. I've got 3 epidurals.
Wow.
Nothing. I'd have pain relief for a little while, then it would come back. And that's just the way. So their criteria is after that, then you get surgery. So this is where I'm at. But what I noticed after the accident was the first thing was swallowing. A catch, something in my throat. And I still have it. It will move every now and then. The neck thing, everything has so tweaked everything in my body. But the swallowing, that's a scary thing besides the arm numbness. It's gone from no numbness, from neck pain, from that. It so is alive that it morphs. I've been doing PT. They put the TENS on, and then it sizzles everywhere. I can take it and sizzle it within my body, and just take that.
It feels sizzling.
It feels like right now it's sizzling. So I go into I walk doing Tai Chi.
So is that more like it's like burning sensation too, or tingling?
Tingles, heaviness, to the point of dead. To the point now. This is the scariest. There tends to be numbness.
So when you're pressing on there, you don't feel the tips?
I feel the tips, but I feel them going. I feel it.
Wow, that's no good.
If it ends right, and if it goes to total numbness.
So you said
anxiety.
You trained yourself to write with your left hand now.
Now I'm doing total left. I want that to stay. I'm going to do that forever.
So the MRI is showing crushed discs or something? Or
definite
herniation?
Herniation, definite compression.
Both directions?
You know?
Which way is it herniated? Right or left or?
Well, if I went this way, it's probably out that way.
Well, if you turn your head that way, do the symptoms get worse?
No, now when I turn my head, there's very little pain. The innervation in my deltoid is what kills me because it so tweaks that when I gave you that hug, you felt that pop. I move and everything, so I'm so tweaked, I'm popping and locking all the way.
So you're taking Neurontin?
Neurontin every 6 hours. I just got off the Zoloft, cold turkey from 100 milligrams to nothing because I'm already in sizzle mode. I'm detoxing from that particular, and so I'm just one sizzle, cold sweat now, right this minute.
Talking about it because you're talking?
Yeah, right, just because I'm in motion. And that's that. Okay, we just did the test, and I just don't want to move.
Because you can't move. No.
I just don't want to move. It's
So what
just
kind of change has
imperfect.
occurred?
I'm just not feeling pain. I'm just feeling peace.
So when you were lying down, you were having the sizzling in your arms.
Mm-hmm.
And so that accentuated a little bit at first, but then that dissipated, and then you mentioned something about the deltoid area.
Actually, usually it's right here, the major pain.
Uh-huh.
I felt it in
Feeling something in
right
that.
here,
Uh-huh.
just hanging out and just kind of now it's kind of shifted to over here because I'm moving.
Yeah.
In the back. But for a moment, it was gone.
That's good. That's a positive test.
It was so good.
Yeah.
Just don't.
How many
I've had
epidurals?
3 epidurals.
3 epidurals.
And consistently, it would last for a day and a half. You know,
you'd have total relief?
I'd have pretty total relief.
Uh-huh.
And then by the 3rd one, I knew, and so I would be like in suspended animation while that. See, now me just talking about sizzling starting again. Here it goes, and so I'm in sizzle.
Yeah. But so the epidurals lasted a little while, but then you could only have 3 anyway.
Exactly,
and
that was there. The hope is that you get it, it stays, and there's no pain. But for me, the pain always came back. It was very patterned. I figured it out, and stress is the biggest trigger.
Yeah, exactly.
Mm-hmm.
And so, have you ever had a diagnosis of fibromyalgia or anything?
Mm-mm.
No.
Nope.
Okay. And then Neurontin, you're taking that now?
Yeah.
But you're getting off the Zoloft, you said?
The Zoloft's done. Now it's just getting out of my system.
Right.
Which adds to an overall kind of tingling thing, but the arm trumps everything.
Yeah.
I mean, I could probably, I don't know, it's just, it feels like it tweaks here, then the whole rest of the body follows. It goes through this just revolution. You know.
Okay.
This is the most pain-free I felt in months.
Great.
So I feel the tingle coming back just now as if I had to break the spell.